Welcome to Health Diary. My name is Winnie Lubembe and we're coming to you from 4 Points by Sheraton right here in Hurlingham. So today we want to talk about something that is hardly never talked about, or we don't think of it as that condition. I am talking about fibromyalgia. Rings a bell or not? Well, we'll find out more on the same after this fact of the matter. Fibromyalgia is a condition that causes pain all over the body, sleep problems, fatigue, and often emotional and mental distress. People with fibromyalgia may be more sensitive to pain than those without the condition. Although the cause of fibromyalgia is not known, the condition can be effectively treated and managed.
I was diagnosed with fibromyalgia in 2015. It started like persistent stomach pains. Much later on, graduated to these severe migraines for years. Made me immobile for some time. With that came some predominant back pains, and then now those started to become more vivid over time. Persistent forgetfulness. Everything just appears blurry. Gets worse in the evenings especially. Medication also makes it worse. After 9 years, I was relieved at the onset that I finally know what it is I'm going through. The prescribed ways are medication. There's also lifestyle changes. I've had to change the way I eat. Again, physiotherapy. It has definitely affected me professionally. I think for a long time, I haven't had maybe work. I'm not able to have the dream job I want. I'm not able to maybe do friendships 100% the way I'd like, because I'm just so busy dealing with the condition. So I pray a lot. So I'd ask people to pray a lot. Be good to yourself. Extend grace to yourself. There will always be something to do, and there will always be expectations on you. But you can only give what you can give at a certain point in time. Get your mind into something. You keep it engaged, you keep it busy. You could turn it into an income generating venture. Try your best to not give up.
All right, so let's get to understand more about fibromyalgia. To help us with the conversation, we have Dr. Omondi Oyo, who is a rheumatologist. How are you doing today?
I'm doing fine. Good morning.
Thank you so much for joining us. And of course, we also have Karambu Muthaura, who again is here to share her experience and her journey with fibromyalgia. So good to see you.
Good to see you.
Thank you so much for coming by today to just first of all share your experience with us. And of course, I'd want to ask, how are you now?
I'm quite okay, thanks.
Okay. All right. Doctor, when we talk about fibromyalgia, again, it's a big term, right? But try and, help us understand fibromyalgia. When we say someone suffering from fibromyalgia, what exactly are we talking about?
Thank you very much. Fibromyalgia is a painful condition associated with the chronic pain, generalized pain, and it can either be primary or secondary, that it can come on itself, by itself, or can come on top of other existing painful conditions like arthritis, lupus, and so forth.
All right.
And it is not a diagnosis of exclusion, but it is an exclusive diagnosis.
Okay.
But you have to exclude many other things before you say this person has fibromyalgia.
All right. And of course, Karambu, then let's get to understand, when were you diagnosed with fibromyalgia?
I was diagnosed in the year 2016.
All right.
Yeah.
Okay. So then what led to that diagnosis? What was life before 2016?
Around 2006, I started getting migraines and instances of a lot of fatigue.
Okay.
But at the same period of time, I also had prolapsed discs. I had back problems. So I think when I went to the doctors and everything, they concentrated more on the back. So when I'd had surgeries and things seemed to calm down, and I still had a lot of body pain. Then the doctors decided we must check if there's anything else. So I went through tests and all that. So at the end of the day, the rheumatologist told me I have fibromyalgia.
All right.
Yeah.
Okay.
So I used to get a lot of pain and I wake up tired. And there's nothing to explain because, you know, you'd expect when you've had a busy day or you didn't sleep well, that's when you're fatigued. Yeah. But no, for me, you'd wake up and, yeah.
Were there pain?
Yeah, I had a lot of pain.
Okay.
I had a lot of pain, but you see now because of the association with the back, I think it should be ignored or sometimes you'd go to hospital and that you're told there's nothing.
So then when you say you are in a lot of pain, I mean, would you know where exactly you had pain, or is it your entire body was in pain?
My entire body.
Okay.
So I would have pain like anywhere. You know, when you're asked, where is it painful? And
you just can't point and say my joints.
You can't point it, yeah.
Yeah.
But there are places if someone touches, it's just extreme.
Okay.
Yeah.
Dr. when we talk about pain, what brings about the same? I know you talked about it could be primary or secondary, right? Can we start with the primary aspect of the same?
The problem with fibromyalgia, the patient comes and says, I have pain everywhere. And the patient cannot pinpoint where the pain is. But it is up to the doctor to interrogate and look for associations with fibromyalgia.
All right.
Because fibromyalgia, somebody with fibromyalgia, one of the main problems is fatigue. They are always tired. But again, the same thing happens in lupus.
That's true.
Then secondly, somebody with, so you have to do a test for lupus, and if it's negative, you are leaning this side. Okay. Then they have migraine, migrainous types of headache. Then the fibromyalgia may have disturbed sleep. In fact, disturbed sleep is one of the biggest problems.
Okay.
And they go to bed, they can't fall asleep, and even when they wake up tired. They don't get refreshed in spite of the fact that they have slept the whole night.
Okay.
Then somebody with fibromyalgia can have irritable bowel. You are always having loose motions or constipation, alternating with diarrhea, and they get heartburns. And sometimes somebody can concentrate on looking for the cause of the heartburn, and without putting all these pieces together.
Okay.
Back pain is a common problem associated with fibromyalgia. So you try to piece these things together and see which ones are predominating, and then there are common medical problems like thyroid problems, rheumatoid arthritis. We've talked about lupus and so forth, which may present like this. So you do those tests, you do X-ray for the back and all that, then you arrive at a conclusion that this is likely fibromyalgia.
Yeah, and because you mentioned some of these symptoms, which again, like you said, mimic so many other conditions. So again, I think it becomes difficult to diagnose fibromyalgia because you might think that you have, arthritis or you have lupus, but yet that's not the case. So then for fibromyalgia, what are then the direct symptoms that are linked to the same?
The direct symptoms, as we have said, is increased pain sensitivity. The patient is complaining of pain.
Is that like in specific areas of the body?
We have, when you are doing examination, there are specific areas that we look for.
Okay.
We call them tender points.
Right.
And those areas, when you palpate them, you are able to, the patient is able, you are able to say that this is their tender points. And there are usually 11 tender points. And 16 tender points, and you need to get 11 out of the 16.
Out of the 16.
Yes.
Okay.
But that is in the previous criteria. But these days we don't need to get as much as that because there are many other associations with fibromyalgia. The patient can get numbness and tingling sensation which can occur when you have a nerve problem.
Okay.
But when you send this patient for nerve tests, the tests are normal.
Karambu, I saw you smiling when the doctor was mentioning some of the symptoms. So which ones relate more to you?
Most of them.
Most of them. Okay.
The issue of sleeping and also the IBS. Okay. It's terrible. I get constipated very easily.
Yeah.
So I have to keep watching my diet and of course check on my hydration and exercise, and of course, like when I was sent for the nerve conduction tests, there's nothing to show.
That's the thing.
Yeah.
Would you describe the pain maybe from a scale of 1 to 10? How would you rate it?
Normally or?
Yeah, okay, on a good day. Let's start with on a good day. How is the pain?
It's a 4.
It's a 4.
Yeah.
And on a bad day?
Even 9. There are times I get pain and start throwing up and even zone out.
Wow.
So yeah, it can be.
It can be, yeah. It can be really, really challenging. So then, Doc, do we have like risk factors that might expose someone to or predispose someone to fibromyalgia?
Yes, the risk factors generally, there are a lot of studies and trying to find out if there's some genes that can predispose certain individuals to fibromyalgia, so that if it could easily be a genetic problem,
Right.
The gene not yet classified, but lots of studies, and I'm sure that sometimes you find fibromyalgia runs in certain families.
All right.
But secondly is some adversity. For example, those who had advanced childhood tend to have a higher prevalence of fibromyalgia. Then a major catastrophe like being bereaved, losing a loved one, some discord in relationships can predispose one to fibromyalgia, and even a major surgery. We also find that if you have another chronic medical problem, your chances of getting fibromyalgia are high. Like we have found that in the general population it's about 1%. In patients in the medical clinic, the figure rises to about maybe 3%.
Okay.
We have done studies in patients with HIV and we found up to 16%. Diabetics, the figure is higher. So it is like if you have a problem, more is added to you. You know, misfortunes don't come singly.
Yes.
It's like they are coming.
Like they say, when it rains, it pours.
Yes. they keep on coming.
Yeah.
So if you have a chronic problem, another fibromyalgia chances are high.
Okay.
But fibromyalgia is distinct. So you have to tease it out of this problem.
What exactly
What
could
is
it be?
fibromyalgia here, and
Yeah.
what is the other problem? You can have fibromyalgia by primary without having another medical
Any other
condition.
thing? Yeah, but you could have fibromyalgia with something
medical
else.
condition.
It requires then high index of suspicion
High
as
index
well
of suspicion and
before you
very
get the diagnosis.
Diagnostic accuracy.
Absolutely. All right, we'll come back to the same in terms of then the whole diagnosis, the accuracy. You talked about the markers as well. But of course for you, Karambu would also need to understand, so then how are you managing? Because now it's like a constant everyday thing, everyday life. How are you managing as well? So of course all that conversation is coming up after the break. Stay with us. This is Health Diary. All right, welcome back. Glad you're still with us. The show is Health Diary, and to help us with the conversation on fibromyalgia, I am joined by Dr. Omondi Oyo, who is a rheumatologist, as well as Karambu Muthaura, who again is here to share her journey and her experience with fibromyalgia. And Karambu, of course, when the doctor was talking about high index of suspicion, you need to again make sure that thorough diagnosis really is done, just to make sure that we have the actual diagnosis as far as fibromyalgia is concerned. I'd want to understand, so for your case, because there was a lot happening before, and then you had your surgery, and then again the pain still continued. So most of the time, you would focus mostly on the surgery and your back. Could this be the reason? But really, there was something else. So did you have to go through a number of tests? What exactly happened before you got your actual diagnosis?
I went to I saw a rheumatologist who did some tests, sent me to a neurologist, who sent me to do the nerve conduction studies. And then, because I'd seen the rheumatologist for a while, he had his suspicions that it was that. So when he sent me to the neurologist, he just wanted him to do other tests and confirm whether it was fibromyalgia.
All right. So at this point, did you understand what was happening? Did you feel like some sort of relief, at least to know that this is what we're dealing with, other than not knowing what exactly was the cause of your pain?
For me, I was glad I knew what I'm dealing with. Yeah, then I think they were kind enough to give me a lot of literature, things to be reading. So when I had my clinics, I would go, sometimes they'd give me additional materials to go through.
Yeah.
And I like reading, so that wasn't an issue for me.
Yeah.
Yeah.
Okay.
So then I got to have a good understanding of what I was going through.
Yeah. And of course the management of the
Yes.
same. I'll come back to you for the same. But then, Dr., how common is fibromyalgia, especially in the country?
We've not done a epidemiologic survey of the country to come up with a map, but from the worldwide estimation could be at least 1% of the population. But in certain subgroups of population, people with back pain or people with lupus, people with HIV, the people with chronic problems, the figure is higher.
Okay.
And I think there's need for us to look at it. But I think 1% is huge.
It's huge,
That's a big problem. And perhaps it's one of the issues that we used to call Harper syndrome. But it's not very old, the coining of fibromyalgia. It is recent. It's one of the recent additions to the diagnosis in rheumatology.
All right.
And there's a time when there was a controversy whether it is really there or not there. Is it really true? But eventually, people have come to a consensus that there's such a condition called fibromyalgia. Yeah, and it's very common.
Yeah. Okay. And then in children, do we have cases of fibromyalgia in children?
It is now being described in children.
All right.
And I think it is there. We just need to be on the lookout for it.
Yeah.
And we will be able to make a diagnosis.
Absolutely.
Yeah.
All right. So then for you, Karambu, then how do you manage this? Yeah, it's not easy.
Yeah, I'm on medication.
All right.
Yeah, because of the pain. And then sometimes I have physiotherapy, depending on what exactly is happening. Like when my back is very, it's very painful, I'll have physio.
Yeah. Where would you feel sometimes pain in the back? Is it the upper back or mostly?
Both.
Or both?
Both.
Okay.
Yeah. So like currently I'm having a period of physio because I've been having discomfort on this hand. It's been radiating from the back and the neck. And then I exercise.
Okay. And then, Doc, so when it comes to the management of the same, what could happen in an event that a case of fibromyalgia is not well managed? What are some of the complications that might come from the same?
You know, the good news is that the basic foundation of management is to make a diagnosis and discuss with the patient that this is fibromyalgia. This is
what we're looking at, yeah.
And that's part of the therapy.
All right.
It will avoid unnecessary anxiety and unnecessary unproven remedies. Then secondly, we start with pain management, restoration of sleep, which you can use medications, and exercise. Exercise reduces the stiffness, but also exercise restores sleep pattern, which is a problem in fibromyalgia. So we start with those medications, then we move to the other medications like antidepressants, which helps to restore the chemical imbalance in the body. Then, as she has mentioned, there's what we call psychological support, cognitive behavior therapy. With that line of management, 25% of patients do recover, up to 50% get better, but there's still another percentage that we need to work with, 25%, which can go into chronic sort of pain requiring various interventions and getting into severe depression and severe cognitive impairment.
Yeah.
So it can interfere with the quality of life, of somebody. So it requires a lot of concerted effort with the people who understand it.
Yeah. Do we have some people who might just require maybe like a little bit of a, lower dose, others maybe like a higher dose, others just medication, a little bit of exercise here, diet here, and they're good to go, and others just focus on your lifestyle, your diet, exercise, and you're good to go?
Yes, you see, like for example, if you are obese, and you reduce weight and you feel good about yourself, or if you are smoking and you stop smoking, and you stop taking coffee at night, and the sleep is restored.
Is restored.
There are those you need to go to antidepressants. There are those you need to go to psychology, or even combination of antidepressant, combination of medications. There are some patients who even require opiates and get addicted
to the same.
To the same.
Yeah.
And those are some of the challenges that you face.
Absolutely. All right. So then it's different for different people in terms of the management and all that. We need to end the show right now. But Karambu, I'm just curious about the sleep aspect. How long would you sleep? 2 hours, 3 hours?
On periods which I have managed to have proper exercise, it's a bit different. And on periods when I don't have a lot of pain, it's different. So if I had a lot of pain during the day or in the evening, then sleeping becomes a little bit more difficult.
Okay.
But now also with the medication I have, it will help me sleep
a little bit better.
A little bit better and a little bit longer.
Good. And given what Dr. Harry was talking about, how extensive, the diagnosis process is, and also having to be on constant medication every single day, so then how do you manage the same? Is it covered by insurance? Do you have to pay out of pocket? And through that, what will be your call to action?
I have been lucky that I have insurance that pays for most of the things. So unless when there are things that they consider supplements, that's when I may have to pay for some of them from my pocket. But I also realize that the number of people who I know who have fibro, a lot of them the insurance does not cover. Yeah.
Okay. So what would be then your call to action to the government, to the local insurance companies, NHIF, one of them, very quickly?
Yeah, that fibro is an illness like any other, and I think it should be covered by insurance. Yeah, because if you want someone to be functioning properly in the society, then they need to be taken care of health-wise.
That's true.
So it's something that I would ask the government to have it covered under NHIF, and for local insurances especially to be able to cover.
Yeah, majority of the cost for patients.
Yes.
All right, thank you so much, Karam. And of course, Doc, again, what will be your call to action, and especially to the general population? Because we have this culture where if it doesn't hurt me, I'm not going to a hospital. Or again, that to healthcare providers as well, in terms of having a high, index of suspicion, especially when we're talking about fibromyalgia.
I think fibromyalgia is a common condition in society, affecting up to 1% and higher in certain segments, more common in females than males. The ratio is 3 to 1. Wow. And we should accept it as an exclusive diagnosis, as an existing medical condition which interferes with the quality of life. And we should look for it, manage it, so that we improve the quality of life of the population. And the population should also understand it and accept it as a reality. A reality that is existing, especially as a disease which is there, which can be managed.
Absolutely.
Yeah, and we need to invest resources in diagnosis and management of such conditions.
Absolutely. Thank you so much, Dr. Mondioyo, rheumatologist, as well as Karambu Mudaura, who again is here to share her experience and her, story as far as fibromyalgia is concerned. So we say thank you to you, Karambu, as well as to you, Dr. And time now for you to take a look at the health tip.
Let me show you some workouts for abs. Support your back by putting your arms there. Raise both legs up. Then you start by shuffling your legs this way. One, to go direct to the lower part of the ab. All right, there's another one. Hold it this way, hold your head this way. Then squeeze this leg here. 1, 2. You do 30, 40, 50, all right, to the failure. Oh, good. Another one, lie down. Then on your elbows, come up. And make sure while you're there, you tighten your tummy. You can hold it there for a minute or so, 2 minutes, 1 minute, 30 seconds. Also, this one is for the abs. We call it planks.
Well, that's the end of our show today, right here on Health Diary. And of course, our focus was on fibromyalgia. Takeaway message is, let's not assume things. Let's just get to a hospital, especially when you are experiencing extensive bodily pain and you're not too sure what it is. Please go and get checked to get proper diagnosis. So we have to end it here. My name is Winnie Lubembe. Special thanks to 4 Points by Sheraton for hosting us. If you have more questions, feel free to interact with us on our social media platforms down at the bottom of your screen. So until next time, adios.